Hello, my name's Kieran Potts. I'm a Senior Research Fellow with Northwest Ambulance Service. I also lead on palliative and end-of-life care as part of my specialism, and I'm grateful to have had the opportunity over the last year to undertake the internship with ArcGM. Firstly, I just wanted to say I'm really sorry that I can't be there today. I do hope the day goes well, and I just wanted to pass my thanks on to those that have supported me over the last year, whether that's during the regular catch-ups with fellow colleagues or whether that's from those listed on the poster and beyond, really, the ArcGM team and colleagues again from across the Northwest that have helped me to understand my PhD aspirations a little bit further. So starting off, really, I practice as an advanced paramedic practitioner. I have an enhanced kind of scope of decision making. I'm interested in the element of decision making, and I've kind of refined that a little bit further in terms of my research interest. So what we know really here is we're a very busy ambulance service. We know that, we feel that, we see that, we hear it in the news, but we know that we have significant opportunity to touch the lives of those that sadly are approaching palliative or end-of-life situations, and we know that there's a key element that's there from paramedics and ambulance staff. So I wanted to refine this and understand it a bit more. So I started asking questions of myself with the support of Will as my supervisor, and started to kind of really try to understand what the potential was for a paramedic in that circumstance and situation. We also started to consider beyond the paramedics, so the assistant practitioners that work within the ambulance service. So that could be an emergency medical technician, it could be a patient transport assistant, it could be somebody that provides that allied health professional role that isn't kind of commonly recognised unless you work within an ambulance service and you see these roles every day. So understanding really that every ambulance staff member has the potential to have contact with somebody at end of life. So mentioning here around understanding and refining, I am interested in decision making. I'm interested again in medical management, non-medical management, incident reporting, recognising risk, but also really kind of honing in on why I'm interested in that. So started to really explore that questioning further by asking myself questions along the lines of, are we effective as an ambulance service in this circumstance? Are we fulfilling the role that's expected of us, and what is that role really? Is there a variation across UK ambulance services in the provision of service that we see? Is there also an impact that we can recognise either positively or negatively on how we interact with those at end of life as well? So I guess during the internship programme, I was successful in achieving promotion to the role of Senior Research Fellow. It's a relatively new role for Northwest Ambulance Service. It's designed to support and promote kind of strategic elements of research delivery, but it also allows me to maintain my portfolio leading end-of-life care as well, which is something that's really important to me. It's something again that's important to the trust as well, that we ensure that there's continuity, consistency around things, but it intertwines research and my kind of clinical specialism as such. So I think moving forward, I've had the offer from colleagues at Lancaster to offer supervisory support, which I'm absolutely blown away by. It's something that many kind of moons ago I wouldn't have thought would ever be a possibility. I think I've really refined and honed the skills to make sure that I can put together a competitive and ideally successful PhD proposal to study with Lancaster. But ultimately, I want to look at the elements that I'm not so experienced with. So that might be, for instance, the statistics element, the economist kind of side of things that Will's really helped me to understand and explore. So I feel I'm ready to take the next step to submit my proposal to Lancaster to consider PhD studies, particularly in palliative care, which is hosted by Lancaster, and to continue the relationships that I've built really, both with ArcGM, Arc Northwest Coast, and now the Regional Research Delivery Network. It feels like things are coming together quite well, and hopefully we can move things forward and understand a little bit more around the qualitative impact of paramedics. But I'd be researching this as a paramedic with the insight and the understanding of how we work in the Northwest, and bringing that research to NWAS, to Northwest Ambulance Service, so that we can design that collaboratively with partners. So thank you again for your time and for listening, and I hope the day goes well for you all. Thanks again.